When I think of my female patients, I want to capture them before they're starting to lose their bone. When that is happening, that they're in their 40s. And so oftentimes I'm only seeing them for, maybe their pap smear or maybe, just a general wellness check, because they're not necessarily experiencing the fluctuations in estrogen and progesterone that is so debilitating to them just yet. But the studies show that the changes that are occurring with bone loss 2 years before the last period. How are you educating your patients about this specifically? Because I feel like there's this element of, as long as I'm eating enough calcium and if I'm getting enough sun and I'm doing some exercise, I should be okay. But there are specific groups, demographics, races that are more prone to this. So how are you educating your patients about this?
Like you, I used to see people towards the end, and sometimes you're already in it, and it's hard to go back and correct that. These people are sometimes shocked when I bring up their x-rays, and just like it'd be a simple foot fracture, and I'm like, wow, you have a really bad osteoporosis, and they're like, what? No one ever mentioned this to me, and I find it odd that they're 20 years postmenopausal and no one suggested even a DEXA scan, and I think, like you said, the recommendations at such a later point in your life, they're already to the point where the damage is a lot of times done. So we need to be catching those people much earlier. And outside of HRT, we need to be encouraging women to do strength training.
Yes.
And a lot of women are resistant to this, right? They don't mind going to do the cardio, but sometimes they feel a little intimidated to go lift weights, right? But lifting weights and putting pressure on those bones is going to keep those bones strong. You should be doing weightlifting at least 2 to 3 times a week, probably a good 90 minutes a week in addition to your cardio, just to prevent, this type of bone loss.
We were always told, you don't want to get bulky, you're going to get big muscles. And this is not aesthetically what women wanted, to have the idea that they weren't going to have lean muscle tone, they're going to be big, stocky, and bulky. But we know that this is a fallacy. It's not true. You mentioned, I love that you talked about the strength training, because that's what we talk about with my patients too. But I think one of the parts that I would love to hear your thoughts are, for those women who actually may not have ever done strength training, like, how do you get them to start? What is the starting point for them?
I do often recommend a personal trainer just to start, right? Most of us did not start with personal trainers. I can speak for men mostly. We went to the gym, you work out with your friends, or you learn the routines you were doing in high school football. Or sports, so a lot of times, like, if women never played like sports in high school or they were athletic, they weren't exposed to any type of weightlifting, right? So more of them are concerned with just keeping the weight off, staying thin. And like you said, it's a very big concern. They're like, I don't want to get big. I don't want to get big. And, I try to tell them, like, we can change your body composition, but statistics show you're not going to hypertrophy like you think you are, right?
Yes.
You're still going to fit into your clothes.
Yes.
So I think that's important, is to get rid of that misconception that people have, but also to encourage them. I think personal trainers, especially if they've had no history of working out, it's a way to go. And I'm not saying that you have to. It's like I tell people with physical therapy, right? I love physical therapy. And they're like, well, I can't go for 6 weeks. I can't do this. And I'm like, but you can go for a few weeks and they can teach you what you can safely do because you have a gym membership. So it's the same with personal training. You invest in yourself for a few months, 2 months, 3 months. You learn the things to do correctly.
Yeah.
And then you go from there. We don't expect you to go in and bench press 225 pounds, but we do expect you to put some weight on there to work those bones.
And those body mechanics are important when you think of gait stability, gait speed, which are the things that you want to stabilize and strengthen to avoid falls later in life. When you think of the 1-year mortality for a hip fracture, you're looking at 20 to 30%, which means that of the individuals who are experiencing a hip fracture, 20 to 30% of them will die within a year, because it is such a strong reason for debility and the inability to recover. So not having that bone strength to support it is important.